Hello and welcome to this Foster Care Institute online training webinar, Illness Anxiety in Youth and Teens. I am your host, Dr. John DeGarmo, founder and director of the Foster Care Institute. I am a consultant to foster care agencies, legal firms, and child welfare programs. A best-selling author of many foster parenting books, international trainer and speaker for foster care and child welfare programs. And perhaps most importantly, I've been a foster and adoptive parent to over 60 plus children and teens who have come through my home and joined my family. Indeed, over the years, my wife and I have had several teens placed in our home and joined our family who have suffered from illness anxiety. Our goal during this Foster Care Institute training webinar is to help you better understand what illness anxiety is and how to best address it. We're going to help you increase your awareness of what illness anxiety is and what it looks like, including the symptoms and the signs. And we're going to help you gain understanding of how to develop and implement some tips and some strategies designed to best help you as you address illness anxiety with the youth that you work with. First, we need to look back on anxiety for youth in the foster care system and how youth and system struggle with so many forms of anxiety. I would like you to imagine a 14-year-old teenage girl. Late at night, caseworkers show up, perhaps even law enforcement, show up to her home, and she is suddenly, without any warning, without any explanation that she might understand, she is removed from her home, removed from her mother and her father, perhaps her siblings. She's removed from her bedroom, her stuffed animals, her belongings, her pets. She's removed from her bedroom, her house, her home, her neighborhood. She's removed from her relatives, aunts, uncles, grandparents, cousins, perhaps older siblings. She's removed from school and her teachers and classmates. If she goes to church, she's removed from church. Everything she knows, without any explanation that she can understand, and she's placed in a residential facility. She's placed with people that she are strangers to her, staff members and other teens that she does not know. She's given a bedroom, perhaps even a roommate. She goes to school the next day. She's surrounded by people she does not know. She's given spelling words and a book to read and a science program. She goes to the cafeteria and believes everybody's laughing at her because she is now a, quote, foster kid, end quote, a label that no teen wants. And she screams out, "I want to go home." You can put aside all of the abuse, all of the neglect, all of the trauma that teen may have experienced before she was placed in the residential home. It is a time of great anxiety anytime a teen is placed into a foster care facility. Because she has questions like, why am I here? Did I do something wrong? Are my parents mad at me? Who are these new people? Will these staff hurt me? Will these teenagers accept me? Will they hurt me? Will I ever see my mother and father again? Does anybody love me? To be sure, it's a time of tremendous confusion and so many questions swirl around in that teenager's mind. She has many concerns and fears. Indeed, she might be filled with anger. Maybe she's angry at her birth parents, in her mind, for deserting her. Maybe she's angry at the caseworker or the child welfare system. She might be angry at the new facility that she's placed in. She might be angry at the staff members and the supervisors. She might be angry at therapists and counselors. She might be angry at the teenagers in the facility. She might be angry at herself. For so many teens, they are filled with guilt because they believe it is their fault. Their fault that they were removed from their home. Their fault that perhaps their parents might have been abusing her in some fashion. It might be her fault that perhaps her parents are incarcerated. It is her fault that she is no longer with her family. And she might be filled with self doubt. Make no mistake, when a teenager is placed into a foster care residential facility, it is a time of tremendous trauma. It is a traumatic experience. And for so many of these teens, they are now trying to process and understand the great many different emotions and feelings that are swirling around inside of them. Suddenly, they're in a new home with new rules. Rules that she doesn't understand, rules that she's never had to follow before. Perhaps she's coming from an environment, a home where there was no structure, where there are no rules or expectations. And she now has new parents or parental figures, if you will. So many teens in the foster care system experience something known as separation anxiety. And as she goes to a new school, for so many teens, they fall quickly behind academically. There are academic and behavior issues. Indeed, 65% of these youth in the foster care system will end up homeless at some point because 55% will drop out of school. Teens in foster care are on average 18 months behind academically, and they struggle with reading and math skills as well. The removal without any type of notification can be extremely traumatic for that teen. So many times a teen is unprepared to be removed from her family and to be removed from her home. She's unprepared when the caseworkers and perhaps law enforcement comes into the home very, very quickly, and they throw the belongings of this teenager into garbage bags. There are quick goodbyes between the parents, the biological family members, and the teen. And in no time whatsoever, she seems to be in a home, a residential facility with strangers. For that teenager, she has no control. She feels she has no control over the situation. She did not ask, or she did not have control of being removed from her home, of being removed from her mother and father. She had no control of being placed into this residential facility. She had no control of being placed into foster care. She had no control of being placed into a home with strangers, with staff members, with other teenagers. She has no control of being placed into a different school system, perhaps. She has no control. And to be sure, this leads to more anxiety. For those teens that experience something known as multiple displacement, or going from one home to the next, to the next, to the next, there are emotional, psychological, and social effects. Indeed, each time a child is moved from one place to the next, their mental health is threatened. And as we noted before, and as we note in the book Helping Foster Children in School, youth in foster care's academic performances are often lower than the traditional student. Now, it is important. In fact, it is absolutely critical for that teen, for every teen, to form at least one healthy relationship. One healthy, positive, loving, trusting relationship with at least one parental figure, at least one caretaker in his life, in order to develop both socially and emotionally. And when that teen is removed from her home and placed into another home, a residential facility, if you will, well, this makes it even more challenging, more difficult, and more traumatic to form relationships. This is why so many teens in the foster care system have issues of trust and issues of attachment. For much more on this, please watch the Foster Care Institute online training webinar, Anxieties and Disorders. Now, with that in mind, what is illness anxiety? Well, illness anxiety was once known as hypochondria. Perhaps you've heard of the term hypochondria or hypochondriacs. Illness anxiety. Illness anxiety disorder is a mental health disorder that can affect children and youth. Youth who have illness anxiety disorder, they worry a great deal about being sick, even though they have no symptoms, even though they do not register a temperature, even though if you place your hand upon his forehead, it's not warm. Illness anxiety is often known also as health anxiety. Now, let's look at some definitions of illness anxiety. Our first definition comes to us from the Cleveland Clinic. And the Cleveland Clinic defines illness anxiety as the following. Quote, illness anxiety disorder is a chronic mental illness, sometimes known as hypochondria. People with this disorder have a persistent fear that they have a serious or life-threatening illness despite few or no symptoms. Medications and mental health therapy can help. End quote. And we thank the Cleveland Clinic for this first definition. Medline Plus defines illness anxiety as this, quote, illness anxiety disorder, IAD, is a preoccupation that physical symptoms are signs of a serious illness, even when there is no medical evidence to support the presence of an illness. End quote. And we thank Medline Plus for their definition. A third definition comes to us from the National Library of Medicine, and they define illness anxiety as the following. Quote, illness anxiety disorder, previously called hypochondrias, is a psychiatric disorder defined by excessive worry about having or developing a serious undiagnosed medical condition. People with illness anxiety disorder experience persistent anxiety or fear of developing or having a serious medical illness despite normal physical examination and laboratory testing results. End quote. Thank you to the National Library of Medicine for this definition. And finally, our fourth definition comes to us from the Anxiety and Depression Association of America. They define illness anxiety as the following. Quote, health anxiety is a fear and preoccupation with a belief that one has or is in danger of developing a serious illness like cancer, ALS, or a heart attack. It involves the misinterpretation of normally bodily sensations as dangerous. End quote. And again, we thank the Anxiety and Depression Association of America for this last definition. So we've seen some definitions of illness anxiety. What is illness anxiety a symptom of? Well, to be sure and to be true, illness anxiety is natural in all of youth. In fact, it's normal in all of us. Illness anxiety could be very, very brief. It might revolve around a single event or experience, or it could indeed be long-lasting. To go further, long-term illness anxiety behaviors can be a symptom of other mental health conditions. These mental health conditions might include the following: conversion disorder, delusional disorder, depression, generalized anxiety disorder, obsessive compulsive disorder, panic disorder. Now, we mentioned it could be a symptom of other mental health conditions. We are in the midst of a mental health crisis since the lockdowns of 2020 and 2021. We have seen a great rise of teenage suicide attempts. Child and youth depression is at an all-time high. Anxiety among children and youth are also at an all-time high, as well as addictions. Yet teens are at greater risk of experiencing illness anxiety if they experience the following. For those teens that are uncomfortable or unfamiliar with natural bodily functions and sensations might have a greater risk of experiencing illness anxiety. Those teens who are raised in a family where health anxieties are often openly discussed in the family, perhaps on a day-to-day basis. These teens are at greater risk of experiencing illness anxiety. Teens have a greater risk of illness anxiety if their caretakers are also intensely concerned about health issues. Teens who have experienced serious illness or who have had a sibling experience serious illness are often overexposed to health related materials. All three of these examples are often allowing teens to have a greater risk of illness anxiety. And we thank the Psych Central for these examples. But what are the causes? What are the causes of illness anxiety? Well, in truth, scientists and doctors are not exactly sure what the exact cause of illness anxiety is. Indeed, the exact cause of illness anxiety is unknown. But there are several factors that might play a role in a teen experiencing illness anxiety. To begin with, those teens who have mental health issues, well, that might lead to illness anxiety. And as we noted earlier, we are in the midst of a mental health crisis. Therefore, many teens today might be experiencing illness anxiety due to other mental health issues they're facing. Another cause might be that a parent of a teen is ill, is sick. This might trigger fears or concerns within the teenager himself that he is also sick. Teens who are afraid that they are sick from watching news story on illnesses and viruses and diseases might experience illness anxiety. Indeed, during the lockdowns of 2020 and 2021, it seems that the news was always reporting story after story after story of a COVID virus. And for so many youth who are continuing to watch that news, in fact, they were unable to escape that news, well, they were at risk of experiencing illness anxiety. In addition, the teen might worry that he also has an illness and he might develop very, very serious concerns for his own health, his own well being. One cause might be that the teen might hear from his peers at the school, in the neighborhood, at the residential home, etc. He might hear from other people his own age about health related issues occurring nearby where he lives. When this happens, the teenager might internalize what he hears. As a result, he might develop unnecessary fears, unnecessary concerns about catching the illness, catching the virus, etc. And finally, for those teens whose parents suffer from illness anxiety, well, there's a likelihood that he also might adapt this anxiety. We've looked at some of the possible causes. So, what does illness anxiety look like? What are some of the signs, some of the symptoms that the teenagers that you are working with, the teenagers in the home, might be suffering from illness anxiety? Let's look at some of those signs and symptoms. Teenagers who often are absent of clinically relevant symptoms often could be a sign that they have illness anxiety. Those teens who are always asking to have their temperature taken, at the very least, once a day. Or those teens who are asking to have your hand placed upon their forehead to see if they have a temperature. Well, that might indicate that they have illness anxiety. Those teens who are always worried, excessively worried about life threatening or debilitating sicknesses could be a sign that they have illness anxiety. In addition, another sign might be extreme anxiety about health related issues. Teens who try to avoid medical care or try to avoid overuse of medical care might be a sign that he is experiencing illness anxiety. And for those teens that worry, their worry exceeds the seriousness of a medical condition that they actually are experiencing. Well, that could be a sign that they have illness anxiety. And we thank the Diagnostic and Statistical Manual of Mental Disorders, the 5th edition, for these signs and symptoms. But let's dig into this further. Let's look at some more everyday signs and symptoms. For that teenager in the residential home who's always talking about being sick or always suggesting that he needs to get something checked out by a doctor, that could be a sign that he has illness anxiety. Teens who try to avoid social activities such as sporting events, dances, musical events, activities in the home, or whatever it might be. They're avoiding it because they're afraid of becoming ill or becoming sick is a sign. Teens who are always seeming to be in the emergency room, always visiting the emergency room at the hospital, could be a sign that they have illness anxiety. Perhaps you are working with teens or teens live at the home who are always doing self examinations on themselves during the day. That could be a sign that he has illness anxiety. Teens who are always researching health. They're obsessive about health research, whether it is online, whether it's on social media, whether it's on books, or whatever it might be. It could be a sign. Those teens who overuse or they have unnecessary use of health supplements. Those teens who are always washing their hands, repetitively washing their hands throughout the day, or always reusing sanitation materials. That could be signs that they have illness anxiety. Teens who self medicate, using some sort of self medication could be a sign that they have illness anxiety. Those teens who spend a lot of time reading about illnesses, viruses, diseases. They're reading about it, perhaps they're watching videos online, maybe they're looking at websites, maybe they're reading books, but they're always reading or researching about illnesses. That could be a sign that they have illness anxiety. Those teens who are afraid to visit the doctor or they have too frequent doctor or school nurse visits could be a sign. Those teens who are always using medical supplies as like bandages unnecessarily or excessively could be a sign. There might be those teens in the home who are afraid to go to the doctor's office. They're afraid to go to the doctor's office because they are afraid of being diagnosed with an illness, being diagnosed as sick. Or they might be too sick to receive proper help. They're afraid to go to the doctors because they might be diagnosed as being too sick, gravely sick, and they are unable to receive the help that they need. Those could be signs that they have illness anxiety. Now, some teens might go to the doctor's office and demand that they be diagnosed with an illness that they believe they suffer from. Perhaps they've heard in the news or social media about an illness or a virus or a disease that is in society, and they believe that they have it. So when they go to the doctor's office, they demand that they also be diagnosed with that illness. Or they may have friends in the neighborhood or at school who are sick, and again, they go to the doctor's office and demand that they also be diagnosed with that illness. There are more complications. Those who suffer from illness anxiety, they have so much anxiety within themselves about being sick. They have this anxiety about being sick that it stops them, it impedes them from having a normal lifestyle, so to speak. They're unable to form relationships. They're unable to form friendships. They're unable to do the work in school. They're unable to participate in extracurricular school activities such as athletics, music, theater, clubs, etc. They have a job, they're unable to go to their job because they feel so much anxiety about being sick. And this anxiety stops them from going forth and having that normal lifestyle. So we've looked at some of the signs and symptoms, we've looked at the definitions, we've looked at some of the causes and the complications. Now, how do you help? How can you help a teenager in the home who is suffering from illness anxiety? Well, to begin with, you need to reassure that teen. He needs reassurance. Acknowledge what he has said to you about his illness, about his feelings that he is sick. Let him know that you've heard him, but do not encourage it. Do not encourage that he is sick. Do not feed into it, so to speak. At the same time, you do not want to say such things as, it's in your imagination. It's all in your head. You're really not sick. You're just imagining it. These are things you do not wish to say, because if you do say that, it will even push him even further into his anxiety. Instead, let him know. Let him know that you're listening to him. Let him know that you've heard what he said, and encourage him to share with you his thoughts, his feelings. At the same time, try to ensure that he feels safe. So many teens in the foster care system have come from an environment where they were not safe, where there was no sense of security, where they did not feel supported in any way, and they certainly did not feel heard. One way you can help him with his illness anxiety is to let him know that he is safe, that nothing is going to harm him, including illnesses or viruses, while he's living in the home, that he is secure, that you support him, and that he is heard and validated. Now, it is very likely that he might not understand health related issues. He might not understand the difference between good health and truly being sick, or true illness, if you will. So, one way you can help him is to teach him signs. Show him what good health looks like, and show him what being sick looks like. Show him what good health versus true illness is. For those teens who have illness anxiety, you can help him by teaching him illness anxiety following self-help tips. Self-help tips that will help him combat his anxiety. First, help him to focus on his hobbies and his interests. Help him to focus on what he loves to do or what he's good at doing, some of his strengths, if you will. If he loves sports, help him to focus on sports, athletics. Help him to focus on, if he enjoys cooking, then cook alongside him. Help him to focus on music and art. If he enjoys working with animals, help him to focus on those things that he loves to do and that he's interested in. Because when he focuses on those things, he's no longer focusing on the illness anxiety itself. He's no longer focusing on being sick or the latest virus or disease that's out there. Again, help him by focusing on his hobbies and his interests. In addition, you can also help him by teaching him some relaxation techniques and stress management skills. Relaxation techniques and stress management skills that he can use when he's being overwhelmed with his illness anxiety. For much more on this, check out our training webinar here at the Foster Care Institute on stress management skills. You can help him by avoiding talking about your own personal aches and pains that you might be experiencing every morning or in the afternoons or when you get up from a chair. Do not talk about those aches and pains. Do not talk about your own minor health concerns in front of him. Because if you talk about your own aches and pains and minor health concerns, it just leads him to focus more on his illness, anxiety, and he might imagine that he is suffering from what you suffer as well. So avoid all talk about your minor health concerns in front of him. You might want to inform him that there are times when focusing too much on being sick, too much on the illnesses or the viruses in society. Let him know that when you focus too much on that, that can lead to anxiety. And help him focus on the many positives in his life. He may not see those positives, but you surely do. Perhaps he's really good with academics. Maybe he's really good at cooking. Perhaps he's really good at gaming. Maybe he's really good at working with animals. Whatever his strengths and his positives are, help him to focus on that. Because when you help him to focus on the positives in his life, that may help him feel more in control. And as we noted earlier, youth in foster care feel they have no control over their life. So when you're helping him to focus on those positives, he might feel more in control, and this also helps to release those feel-good chemicals in the brain. Many social media sites today both promote and encourage illness anxiety. And it's very easy for today's teens to locate and find those social media sites. In addition, there are many sites that are also pro-suicide sites as well, as we note in our suicide prevention online training webinar. So talk to the youth about these sites and warn them about potential dangers of visiting those sites, about spending too much time scrolling and researching and watching videos about illnesses in society. Finally, limit his social media usage. No teenager needs to spend 3, 4, 5 hours online or on social media. In fact, that's actually not healthy. So limit his time and encourage him to do something else instead. Go outside for a walk with him. Cook alongside him. Dance with him. Play sports with him. Help him with his schoolwork. And at the same time, monitor what he's visiting and monitor what he's watching online as well, in order to ensure that he is not visiting these pro-illness anxiety sites. There's also a number of professional help ways that you can help the child with illness anxiety as well. Now, when you seek out a professional therapist or a professional counselor or professional help in general, that does not mean that you're a failure as a staff member, as a caretaker, if you will. In fact, it means the opposite. When you seek out professional help for this teen, you're being proactive. You're recognizing that he needs more help than you're able to give him. And when you seek out that help, you're doing just that. You're helping the teenager and you're helping yourself as well. So let's look at some of the professional help ways. First of all, there is the cognitive behavioral therapy, or CBT. Cognitive behavioral therapy helps the teen to reduce his fears and his anxieties. You see, during cognitive behavioral therapy, the teen learns to recognize and he learns to understand the false beliefs that might set off his anxiety. Much research has shown that cognitive behavioral therapy successfully teaches those with illness anxiety to identify what triggers his behavior, and at the same time it helps to give him coping skills to both help his anxiety and to manage his anxiety. Exposure and response prevention is another way to help this teen. During exposure and response prevention, therapists will ask the teenager to take small steps. Small steps, perhaps every day, towards changing his behavior. For example, the teenager and the therapist might both set a goal that the teenager will not go to the nurse for at least one whole day. The teenager and the therapist might have set a goal that the teenager might not check his temperature at least once an hour, or perhaps once a day. The teenager and the therapist might set a goal that the teenager will not visit pro-illness sites once a day. The teenager and the therapist might set a goal that the teenager will focus more upon his positives and his strengths for a whole day. There's a number of examples that the teenager and the therapist can work towards when it comes to exposure and response prevention. And this is one great way to help the teenager. In addition, behavioral stress management or exposure therapy can also be helpful for the teen who suffers from illness anxiety. And for some, psychotropic medications, such as antidepressants, are sometimes used to treat health anxiety disorder. Now, when it comes to any sort of medication, it is absolutely critical. It is a must that you ask both the doctor and the caseworker or supervision for permission. That comes to any sort of medication, whether it is antidepressants or psychotropic medications or medicine for a cold or a cough or even pain reliever. You must ask your supervisor for permission, and of course, you must properly document. You must properly document every time you give medication to a teenager for any reason: the time, the date, the location, the amount or dosage. Caring for youth in foster care system can be tough. In fact, it can be downright exhausting at times. And all of us need a little bit of inspiration now and then. The Little Book of Foster Care Wisdom, 365 Days of Inspiration and Encouragement for Foster Care Families, is a great book for you as you care for youth in foster care. It will give you some tips every day and a little bit of encouragement as well. And I'm sure we have many books at the Foster Care Institute that would be helpful for you as well. For much more on this topic and so much more, including articles, webinars, videos, podcasts, all to help you as you care for youth in foster care, visit our website, the Foster Care Institute, or drjohndegarmofostercare.com. You'll find so much there as you care for teens in crisis. Follow me on Facebook and Twitter for daily updates and daily information and tips on caring for youth in foster care. And email me at drjohndegarmo@gmail.com if you have any questions about this webinar or anything else I can help you with. Again, working with teens in the foster care system can be challenging. No teen wants to be in the foster care system. And some teens can be challenging as you try to work with them. They have issues of trust and attachment. Perhaps they are surrounded in feelings of guilt or grief or anger. They're confused. They feel isolated. They feel alone. And they need someone like you. Make no mistake. Make no mistake. You are changing the life of that teen every time you work with him. You're making his life better. And for that, I thank you. I thank you. You are a superhero, and you are an angel, and you inspire me. For the Foster Care Institute, I'm Dr. John DeGarmo. Thank you so much for taking time to watch this webinar.